This is Sudarshan again with Revised Spine and Sport Physical Therapy and Chiropractic Clinic. As a part of our series in terms of getting you ready for recovery, we're going to talk about spinal stabilization exercises. We got to understand that these exercises may not be appropriate for everybody. You got to be adequately evaluated by a trained professional who's a chiro or a physical therapist to ensure that these exercises are right for you. That being said, we're going to start with the most basic of those exercises and work ourselves to more difficult ones. We got to divide our exercises into something more static and stable to more dynamic in nature. Also, we divide our exercises in levels of pressure that goes through your spine. So as you can see, Shane, our model, thank you, is laying down right now. There is hardly any pressure that goes through the spine. So this is going to be one of the lower level exercises to get some of the stabilization going on. And then in our subsequent videos, we're going to add more and more exercises to it in terms of the progressions themselves. Let's start with the very basic one. This one is called the abdominal drop. Shane will have both knees bent. And this particular portion of the exercises is going to be maintained throughout the rest of the series because we want the spine to be more stable. At home when you do it, you can always have a face cloth folded and kept behind the spine. And right now Shane has it. And that gives you a feedback so that like you're not going to lose your arch or stabilization in your spine. So your back of the spine has to be touching that face cloth which is behind your spine. So let's have the hands placed just above your hip bones, and Shane's going to pull that muscle towards the spine, maintaining that for 5 seconds and repeating up to 20 times could be your first exercise, which would be very basic, but we're going to add some movements to it. Let's start with some movements for the leg. The first exercise is where Shane moves it towards one of his legs towards the chest. We can repeat it 15 to 20 repetitions, and we can always do the same exercise on the other leg as well. Keep in mind, anything that can be repeated on the other side, so long as it doesn't give you pain, you can do that. The second exercise, maintaining the abdominal draw, Shane's going to slide his heel down as far as he can without letting the spine arch as well. And then we'll come back, another 15 to 20 repetitions of that. And then you can do the same on the other side as well. Now we're going to introduce other muscles into it. A little bit of an angle muscles like your obliques to be strained a bit with the same abdominal drop. Shane's going to drop one of his knees down. And then he'll bring it in, repeating it same number of times. And then you can do the same on the other side as well. As a progression to this, you can always do rotations to both sides with both knees together. Keep in mind, we do not want the spine to be moving, so do not rotate to the point where your spine is coming off of your bed. Now we can make a further progression to this by having a pillow, a ball, or something of that nature. Like in this case, in the clinic, I'll make sure that he's doing it right. So Shane's going to press my hand, or the ball at home, or the pillow, to do the same rotation exercise while he's maintaining the pressure. So we can do a second series of progressions in the same position, but this time we're going to do those progressions using the arms. How we do is maintaining the abdominal draw. This, it has to be, you got to get used to the abdominal draw by this time because in previous occurrence you had a feedback mechanism with your hand. While Shane maintains his abdominal draw, he's going to raise both arms up as high as it can go without losing this arch in the spine as well. Now, as you get used to this, about 15 to 20 repetitions, doing it slowly, it's time for us to integrate the two together. Shane can lift his arm to about knee high, both of them, and then he can do alternate leg lifts. Knees to the chest, similar to the first ones. And then we can even make it even harder by lifting both knees together up at the same time. Further difficulties can be imposed by lifting knees at the same time and doing rotations at the same time with both knees. There you you go, another 15 to 20 repetitions. These gives you some basic beginning on very limited loading spine stabilization exercises. Thanks for watching the video. As a part of the lumbar series in terms of progression for loading and stabilization. So we've moved from laying on your back type of exercises to laying on your tummy type of exercises. Most often than not, when a client walks into our office, we often find that people do similar exercise, but there is an error in which they would do this particular exercise. We've seen them doing this exercise with them laying flat on their tummy without anything underneath to decrease the pressure on the spine. So we suggest that you would have a pillow under your tummy, so that decreases the amount of force that goes through the spine as an important part. And so even in a scenario where you have decreased movement in your hip, this is not going to add more strain to your lower back, leading to more pain when you do these exercises. As a first portion of the exercise, we're going to ask Shane, while you have a comfortable position of this nature, lifting one leg at a time, keeping in mind your focus should be not engaging too much here to the point of arching, but to get these muscles recruited down here. Hold for 3 to 5 seconds on the top, repeat 15 to 20 times on each leg. That is number one for you. Number two, we can do the same exercise at engaging from a different perspective, lifting one arm at a time. And so you would do 15 to 20 repetitions for each arm. Progression from there would be lifting opposite arms and legs. So you do the same thing as well. Remember, progressions are not something to be done on a daily basis. You do them when the exercise becomes easy for you. There is a fundamental difference between hurt and pain. Hurt is if you have a little bit of a soreness when you do your exercise, you are generally okay with it. Pain is if you have progressively worsening discomfort which lasts after you're done with your exercise of any kind. You may not have to do that exercise at that time. So the progression from that particular area is to move on to a hands and knees position. So the first exercise in hands and knees position is a cat-camel exercise to get some degree of mobility in your spine. As you can see, Shane is now arching his back to that of a position of a cat, and then he's going to go all the way up to mimic a camel here. This starts some basic mobility exercise while you're engaging your stabilizers at the same time without putting too much load on the spine, as the loads are going through now your arms and legs. And you do about 15 to 20 repetitions of this as well. And you progress from there, the same sequence of exercises that we did on your tummy, lifting one of your legs to straight, and then repeating 15 to 20 reps, and then the other leg. And you can do the arm reaches. When you do the arm reaches, when you lift, what I typically like to advise is that you're going to try and reach an inch or two a little bit further while you're trying to maintain your tummy tuck there, your abdominal draw that we talked about in the previous video. That is what we are looking for, that small reach forwards. Now you can always make this exercise harder by lifting opposite arms and legs. And then we can further make it difficult by adding more resistance into your hands. So one of your arms is going to hold on to a resistance while you do the lifts, and then hold for 3 to 5 seconds, and then you repeat it, and you will do the same on the other side as well. You can increase the level of difficulty by adding resistance to your legs as well. You can get an ankle weight on. So you can just keep the arms free of resistance, and you will do the leg part of it with free arms. And then you can include the arm part of it without resistance. And then in the final stage, you can have resistance in your arms and legs as well. As a part of our lumbar stabilization program, we are now moving from static set of exercises, which you saw in our previous videos, to a dynamic set of exercises where the spine is actually going to move while you're trying to train. As you could see, the amount of pressure that's going through the spine is still very minimal because Shane is just laying down here. So the first part of the exercise is still going to be the same, which is part of the abdominal draw. as we discussed before. And we're going to start with the half bridge from that position. Shane has two things to think in mind. He's going to maintain the abdominal draw, he's going to hold the position, he's also going to think about the pain. If there is pain, rather than a hurt, you gotta know that you're not ready for this exercise yet. A little bit of discomfort's okay, but progressively worsening symptoms are not okay. So the first exercise is leg lifts. Shane's going to lift his knee up towards his chest and bring it back down slowly, 15 to 20 repetitions. And we'll do the same on the other leg as well. The second exercise is alternate leg lifts as you get better, because it's shifting weight between the two sides constantly and challenging your spine and the muscles. The third progression from this is Shane's going to take a couple of steps forward and he's going to step back. This is a rather difficult exercise, as you would find as the heel goes further ahead. The amount of stabilization that you need here is rather more difficult. Then the next progression is for Shane to rotate side to side. And as a progression to rotation, Shane can also include the adductors and the inner group by putting pressure against a ball and doing rotations at the same time. There you go. Further to these, we can progress to make it even more dynamic in nature. We can introduce a parabol here under Shane's legs. And so Shane's going to use this as a measure of stabilization. As you could see, the first part of it, the feet were on the ground. The ground is more stable. So we just lifted the waist up, creating some degree of instability. Now, the support structure is unstable as well. So this is a progression from what we have done so far. Shane's going to keep his legs on it, and he's going to lift his waist up, and then draw his legs towards his thumb, and then push him out. That's his first. So as a progression from there, Shane can include rotations. Small rotations, couple of inches both sides. And a progression from there would be, while Shane's laying down flat, he's going to find a center for one leg only on the ball. The other leg is up in the air, and he is going to try and do the draws with one leg on the ball with the bridge. This is one of the last progressions that you can do. And you're now going to start with these exercises, obviously, as you can see. And further progressions to these could be introducing a ball under the feet. So you have a smaller structure, which makes it more difficult to balance. Shane's going to lift his waist off the floor and do the back and forths. And if possible, side to sides as well. That concludes our laying on our back, dynamic and static progressions for spinal stabilization.